My name is Delia Burridge and I'm one of the volunteers with Voices of Wentworth. Voices of Wentworth acknowledges that we're on Gadigal land in the Eora Nation. We pay our respects to elders past, present and emerging. Voices of Wentworth is a non-partisan community-based organisation that's not aligned with any political party and is staffed by volunteers. We established the group exactly a year ago because some local people felt that there was a disconnect between what people in the electorate want and what they're getting in terms of federal policy. I'd like to take a moment to thank all the volunteers and participants who've helped Voices of Wentworth over the last year. You are awesome and we are very grateful. We set up Voices of Wentworth to engage the local community, to better understand what citizens care about and to advocate for issues they support. We promote democracy, accountability and transparency in the political process. When we're not in lockdown, we do this by hosting live events where people can have their voices heard, such as kitchen table conversations, voices in the pub and weekly democracy walks. When we are in lockdown, we go online. There's 3 opportunities I wanted to quickly tell you about. We'll be posting a link to a questionnaire in the Zoom chat. We'd be really grateful if you could take 10 minutes after tonight's presentation to complete it and to share it with friends. We will be having a virtual Voices in the Pub night on Wednesday, the 4th of August. So email us if you'd like to join in or respond to the Facebook event. Our next town hall, which will be by Zoom, will be held in late August on the topic of what's the future for environmental protection. One of our key activities is to listen to local people, their concerns and provide access to subject matter experts. Right now, there's no bigger issue than how we should deal with the pandemic. People in Wentworth are now in the 26th day of their second lockdown, with stay-at-home orders in place until at least 30 July. There's a great deal of uncertainty and confusion in the electorate about how the pandemic will be managed going forward in terms of vaccine availability for younger people and children, economic support for local businesses and workers, and the best way forward to protect older people. While there's a lot that could be said about the way the pandemic has been managed at both the federal and state level, today's focus will be on the way forward given where we are. People are keen to know what's the best way out of this. We're very grateful to have a fantastic panel with us tonight, considering that each of our presenters is busy actually managing the pandemic or its impacts. Professor Mary Louise McLaws is a professor of epidemiology, hospital infection and infectious disease control at UNSW. She's a member of the World Health Organization's Health Emergencies Program Experts Advisory Panel for Infection Prevention and Control Preparedness, Readiness and Response to COVID-19. Mary Louise is here to address your questions about how to get the pandemic under control. Rick Deverill is the chief economist for Macquarie Bank. He has spent 30 years analysing the global economy and financial markets. Rick will address questions about the state of the Australian economy and the best way forward from an economic perspective, given the challenges posed by COVID. Craig Geer is the CEO of OPAN, which is the Older Persons Advocacy Network. Prior to OPAN, Craig was the director of a health consulting firm focusing on primary care NGOs, ageing, mental health, e-health and Aboriginal health. Craig will talk to the impact of COVID and COVID controls on older people and what policies could help in this sector. Each of the speakers will give a short presentation and then we'll go to questions. We asked our supporters to provide some questions in advance, so some of the questions will come from me, but there's still time to put additional questions in the Zoom chat. Make sure you use the word question in capital letters at the front of your post so that they're easy to spot amongst the comments. One of the Voices crew will read them out after the speakers have given their presentations. So first up, I'd like to welcome Mary Louise McLaws.
Thank you very much. Can I share my screen? Because I have a small presentation to show you about what I think are the important issues to date. So, sorry, my computer is thinking. How's that?
Looks good.
All good? Great. I'm on Bedegal country, and I'd like to acknowledge elders current, past, present, future, and all Aboriginal and Torres Strait Islanders who are here present today. Dr. Tedros at WHO reminds us that none of us are safe until everyone is safe, and that is so true. We're in a global village, and until we stop the virus from circulating, we are constantly at risk of mutations. So let me just show you, this is the latest one on the 20th of July. WHO does the maps every so often. And down on the right-hand side lower corner, you'll see that Delta has now found its way into 124 countries. Just a month ago, it was 80. And WHO has described Delta as the fastest and the fittest mutation that they've ever seen. Why is it faster? Because it seems to have blatantly disregarded all our infection control knowledge that we've got to date, and that is, if we keep our distance and if we're outside, we're at less risk, and that children aren't at risk. And those rules don't apply very much anymore. The CCTV observations of the driver in the shopping mall and the MCG are just two examples of how you don't have to be very close to somebody who's exhaled a lot of particles. And until we actually get our vaccination rates up high, we are not going to stop any variant from continuing and learning more methods of how to get past our immune system and also our immunity that we've acquired from vaccines. So on the left-hand side here, this is the vaccination efficacy for symptomatic infections. And if you have a look under the Delta, the B1617.2, Pfizer doesn't do as well with just one shot, and neither does AstraZeneca. You really need that second shot. And in fact, with AstraZeneca, I've noticed that adults over 60 are not having their second shot nearly as fast as they really should. So, of course, AstraZeneca does give you 67% protection against symptomatic infection. But what it does do, it stops the elderly from dying, from being hospitalized with severe infection. Pfizer, on the other hand, provides an excellent prevention against symptomatic infection and therefore transmission by the young. And once again, of course, it protects against death and hospitalization. But this is the reason why we need to focus Pfizer on the young, because the young are the ones that have, they did have 40% of all caseload from 20 to 39, 40%, and that's across two age groups. If you have a look at the proportion of people across any other two age groups, they don't match 40%. And if you have a look at Delta at the moment, it appears in Sydney that in fact it's many times higher than that. So the young we need to protect them from continuing that, getting it and passing it on. We don't have yet a target of how many people we need to vaccinate. The US wanted at least 70% of people vaccinated by the 4th of July, at least one shot. They didn't get there, sadly. New Zealand is 80% of the total population. China, 70 to 80%. WHO says 70% of every country needs to be vaccinated. Singapore, 75%. Israel, 66%, and that's because they're using Pfizer, so they don't need as many people covered given Pfizer efficacy, and we don't have one yet. However, I have developed one. So, based on the fact that the UK are experiencing an enormous problem in the 5-year-olds to 17-year-olds and the 18 to 24, that group of people are carrying the majority of Delta than any other age group in the UK. Now, you'll say to me, yes, but that's because they're not vaccinated. Absolutely. But the 18 to 24-year-olds have been offered vaccination. They just think that they are invincible and they're not taking it up. Only 17% of young adults have taken up 2 shots, 17%. And 57% have taken up 1 shot. But we've seen 1 shot of AstraZeneca is not enough. And young ones don't have as much risk of dying. So that 1 shot might help them not to die, but it's not going to help them from getting infection. So what we need at the moment is about 190,000 injections per day to start protecting our 12-year-olds and older if we're going to be vaccinating to get out of here by the end of December. And preferably we need about 80% of the total population being vaccinated. And we need 190,000, but of course we've only reached about 138,000 shots per day. So we're going to have to add more shots to get to the end of December 31. So we're going to have to increase that by at least 1/3 between now and then. How do we do that? We give vaccines to organizations, local governments to try to improve that rollout. This is just for those of you who like the maths, how I developed this based on the proportion that should get AstraZeneca. 100% of us over 60 must have 2 shots of AstraZeneca. And then, of course, based on whether we're dealing with the wild or, of course, now the Delta, and we need at least 80%, 67% at a minimum, 80% we should be going for. And that's all I have to show you so far. So please think about getting your shot and helping to put an end to this circulating virus. If we don't get an end to it, what I'm very concerned about is that the leaders who are used to leading in the good times won't protect us and will just throw their hands up in the air and allow this to circulate. If we allow it to circulate, we will get a super Delta. It'll learn how to get past more people being vaccinated. We need to get rid of this as soon as possible. Thank you, Delia.
Thank you so much for that. Now I'll throw over to Rick to talk about economics.
Thanks, Delia. And I too will just share a few slides, if I may. That should do the trick. So here we go. Okay, so I mean, it's obviously a very difficult time at the moment, and particularly in Sydney and Melbourne and Adelaide, where we're in lockdown, it's very difficult to think about in objective terms what's actually happening with the economy. So as an economist, I always like to go back to the data. And the fascinating thing is that, as you can see from the left-hand chart that I'm showing here, last year we had the biggest bust that Australia's ever had in a 2-month period. GDP fell by nearly 8%. But we've also had by far and away the sharpest recovery that we've ever had. And in the month of June, both GDP and employment were not only back at pre-COVID levels, but they were back above the previous trend. You can see from the right-hand chart, which shows the red line is the long run of the unemployment rate, and the black line is some business surveys talking about how hard it is to actually get people to come and work for you. And the remarkable thing is that the combination of controlling the virus and very large macro stimulus has meant that at a macro level, at least, before these lockdowns, the economy was actually in better shape than it was before COVID. And I think, frankly, that that's a fact that not many people have noticed, given a lot of the noise around. The next question I get is, well, surely it's madness to lock down. You know, surely we need to leave the economy open because all of these people are going to get hurt. And I have a lot of sympathy for that view. But factually, it's just not right. It is now really clear that you can't have a little bit of COVID. You can either have a lot or not very much. And if you have not very much, so if you do essentially eliminate, as Australia has or had, you can have much better economic outcomes. And what I'm showing here is comparing Australia with the United States. And I think this is a really nice way of looking at the trade-off, and it shows that there is no real trade-off. You can see that the Australian labour market on the left-hand side, Australia is the red line, has fully recovered. This is looking at hours worked, not at employment, but you can see it was back at the previous trend. Whereas the United States, which is the black line, you can see hours worked is still 6% below where they would have been before COVID. So, it really is day and night in terms of the economic performance between the two. Now, remember that the United States had a bigger stimulus than Australia. So it's not that our stimulus was bigger, it was that we controlled the virus. And the right-hand chart, I think, is quite striking in that, remember that we've had better economic outcomes and we've had less than 2% of the fatalities per capita. So, this idea that you can let the economy run, and that is good, it is just not true. If you look at the very important services sector in the United States, which is the left-hand chart here, you can see that both services consumption and services employment is still very low. It's nearly 7% below the previous trend. Now, remember, in Australia, services account for 80% of employment. And what's happening here is that even though parts of the United States remained open, because the virus was circulating and frankly was killing a lot of people still, that meant that people were allowed to go out and do things, but they were too scared to do so. Now, of course, we've seen examples of people in Florida or Texas where people are ignoring it, but all you need is 5 or 10 or 15% of the population to remain cautious, and you get the economic damage anyway. So this idea that you can open the economy back up and things will be fine is just not true. It's not true in the United States, it's not true in Europe, it's not true in Australia. And I think people forget that, looking at the right-hand chart, the US has now got something like 630,000 fatalities. And the US is now approaching, this is going to be, by the time we finish, this is going to be the most deadly event in US history. It's already materially more deadly than World War II. It's catching up quick to the Spanish flu. And of course, HIV/AIDS has happened over 40 years, but it's going to overtake HIV/AIDS as well. So this equivalence that people talk about, that the lockdowns are silly, we should let the economy go, activity doesn't happen anywhere because people don't go out, they don't spend. So where are we at the moment? Of course, we are locked down. So we've had this spectacular recovery. Almost certainly GDP will contract in Q3. And it is a very difficult time for a lot of people. People with jobs like myself that I can do from home, this is okay. But, whether you're a construction worker or you work in retail or you work in a restaurant, this is a disaster. So what we need to do is we need to get the virus under control as quickly as possible. You can see from the left-hand chart here that mapping the current outbreak compared to the second wave in Victoria. So far, we have contained the virus. We have not had the exponential growth that they had in Victoria. But it is interesting that it was only about to start now in Victoria. So the next week will be critical. I'm personally very relieved that the Premier has gone harder, and I hope that it starts to work, and I hope it starts to beat it back. If we do bring it under control, as you can see from the right-hand chart here, which is showing mobility in retail and recreation, you can see the dark black line of Victoria, and when lockdowns ended and they controlled the virus, the economy came back very quickly. So if we can contain the virus and we get these numbers down, I think the economy will bounce back very quickly again. So at the moment, all of it should be in stopping it spreading. The thing that worries me most about Delta is we still don't know if we can contain it. So, we've stopped it going up, but with people still circulating in the community, there is a risk that it doesn't. And if that happens, we've got some very difficult decisions ahead. If you look at some of the other high frequency metrics of the economy, things like the property market, for people in the eastern suburbs, of course, everyone loves to talk about housing. When we had the first lockdown last year, the housing market fell for a bit. The interesting thing this time is it hasn't happened at all. House prices are still racing. In fact, house prices are still going up at about 3% a month in Sydney. So what that says to me is that economic actors saw what happened last year. They saw that it was temporary. They saw that things bounced back. It doesn't mean there's not short-term pain, but those big decisions like buying a house are not being deferred. So that's a very good portent if we can control the virus, but we do need to control it first. So ultimately, and this is sort of carrying a little bit of the stuff that Mary Louise talked about, ultimately it is about virus control. we are a long way behind the other countries when it comes to vaccination. So that's why you need the lockdown now. A lot of people say, well, why don't we just do a UK and let it rip? Well, the problem with that is, of course, that the UK, 87% of adults have now had at least the first dose, and 95% of people over the age of 50 are now fully vaccinated in the UK. So we can't do that. It's not clear that the UK can do that either. So we need to suppress. But the good news is that the vaccine is coming. In fact, just this week, Pfizer arrivals stepped up from 300,000 a week to 1 million a week. And as you can see from the right-hand chart here, if people were preferred to take AstraZeneca, which is the grey bar, we would get to where we need to get to in the next month or so. The problem is people won't take Pfizer. I can't really see that changing. So the red bar shows the cumulative number of doses of Pfizer that we'll have in Australia. Sorry, they're not taking AstraZeneca. And we don't get enough Pfizer in Australia until probably November or December. So ultimately, again, a lot of people say, well, why don't we bring back Grim Reaper? Why don't we just scare people into taking the vaccine? The problem is we don't have enough vaccine at the moment. And certainly we don't have enough Pfizer, which you need. I agree completely that we need to vaccinate children because they're spreading it. But the good news is we will get there in Q4. So it's still 3 or 4 months away. It's going to be a difficult period, but there is light at the end of the tunnel. And by that time, our policymakers are going to have very good information. So we're seeing a lot of experiments around the world at the moment. Of course, in the United States, the US is always fantastic because it's not one country, it's 50 countries. And you can see from the left-hand chart here, the spread in terms of full vaccination rates. If you're in the central south, Mississippi, only about 1/3 of your people are fully vaccinated. Whereas if you are in the northeast, if you're in Vermont, it's now 70% of people are fully vaccinated. And in Vermont, fully 99% of people over the age of 65 have had the first jab. So we are going to get very good data over the next couple of months now that Delta is spreading in terms of what vaccination rates you need to control it. The US are vaccinating 12-year-olds, and Pfizer in September are going to apply for permission to vaccinate 5-year-olds. The US will do that, and we will have a lot of data. You can see from the right-hand chart that already, as Delta spreads, you're getting a really big difference in the low-vax states, which is the black line, against the high-vax states, which is the red line. So by the time it arrives here, we will know. We will have a very good idea, absent another mutation. And then finally, of course, the good old UK are also providing us with spectacular data. They're doing a grand experiment. As talked about before, the problem in the UK is that they haven't vaccinated the young people. So whereas they have 95% of people over 65 fully vaccinated, only about 16% of people under 40 are fully vaccinated. And that is where this is spreading. The really good news is that even though you're getting a big increase in cases, as you can see from the left-hand chart, hospital admissions have not gone up anywhere near, and fatalities have stayed low. It's now looking like the overall fatality rate has fallen from about 3% in the last wave down to about 0.2% population-wide. And even in the older cohorts, for those between 70 and 80, it was nearly 25%, and it looks like it's down to 2.5%. So the vaccines are working in terms of stopping death. But the key point I want to leave you with is that we're going to have a difficult period. The lockdowns are very necessary now. But by the time we have enough vaccines to do the whole population, the government will have a very good idea from the experiments going on elsewhere as to how many we need to do and what kind of order you can reopen again. So I'm confident we can reopen again. I think it will happen later this year, but it's still a few months away. I will leave it there.
Thank you so much, Rick, for those comments. That was great insight and offered a lot of comfort. Craig, aged care and older people.
Hi. So I'm Craig Gee. I'm the Older Persons Advocacy Network, or also known as OPAN. And what OPAN does is really supports older people, their families and representatives who are interacting with the aged care system. And we are there basically to walk alongside and take direction from an older person about what they want and what their wishes and preferences are. And it's been particularly interesting through COVID to really actually connect with those older people and actually find out what do they really want, or what assumptions are we making about what they want. So we have nationally about 80 advocates across the country. We've been, as part of the response, really leaning in to support both residential aged care facilities, residents there and their families. And when there is an outbreak, such as what happened at Newmarch or recently at Summit Care, making sure that the voice of the older person is actually heard by the provider, heard by government, and heard by the Aged Care Quality and Safety Commission. This outbreak, this pandemic, has been significantly impacting older people. It's those in residential aged care that have been the impact of the deaths. We know that, and we saw that with the Victorian outbreak, and that was just heartbreaking for some of us from OPAN that were involved with that. But it's also impacting older people living in the community as well. So it really needs to be considered that older people have had to constrain their lives, and more than anyone else. They're not the people usually, not everyone, so I'm not going to be ageist, but not usually the people who can get up, go out to the shops, can dash in, dash out for that one bit of food, and also aren't usually the people who necessarily be up not worried to walk around and do their exercise around Centennial Park or around Bondi. So people are staying at home. People are socially isolated. People's mental well-being is being impacted by this extended lockdown. So really what we've been seeing is older people have their function has declined, and they are also the ones that most at risk of not being vaccinated. And so quite rightly, I think the focus has been on getting those the most vulnerable vaccinated first. That doesn't mean, as Mary Louise is talking about, that now as we start to move through different populations, we shouldn't shift and we shouldn't focus on where the risk of further transmission is. The only thing that is going to get us out of this is getting older people vaccinated, but also that second ring around older people, be it the aged care workforce, be it people that come and visit, be it home care workers. They need to be vaccinated as well. And then we need to think about the other parts of society that need to be vaccinated as well. One of the interesting things for us was also around the assumptions that were made and continue to be made about what older people want. There was naturally, at the beginning of the outbreak and the pandemic, wanting to lock down aged care facilities to protect older people and to not have the virus come in. But interestingly, it wasn't visitors, and the international evidence showed this. It wasn't visitors that were bringing in the COVID. It was staff, and it's one of the reasons why we do need aged care workers and those that reach into residential aged care facilities to be part of this next line of vaccinations, because that's where it was coming in from. But interestingly, there was decisions made around what the rights of older people were to exercise their rights. We often talk about that there's a human rights-based organisation. It's a shame. It seems that there's the rights of the person with disability, but there doesn't seem, and there's the rights of the child, but there doesn't seem to be the rights of the older person to make choices and decisions for themselves. And what we saw through COVID is exactly that. You almost checked your rights at the door when you entered aged care. You weren't allowed to leave. You weren't allowed to go and see your GP in some cases. You weren't allowed to have friends, family and visitors, and if it was, it might be through a window. Aged care is the quickest to lock down, and it's the slowest to open back up again. And so OPAN's really concerned about the extended lockdown and impact on that. So we worked with our cross colleagues around a visitation code that actually facilitated some limited controlled visitation for people, because the mental impact on this for someone that has been locked in their facility, not seeing their family for 18 months, or as one resident said to me, I haven't seen a human face for 18 months. All I've seen is a mask, because masks, and particularly in Victoria, have been in place for all that time. So my call is for all of us to get vaccinated, all of us to see our role as citizens, but also that we protect the rights of older people to make decisions for themselves as well. That when they want to get vaccinated, we allow them to. We have seen a number of cases where family members are taking away that decision and saying for the older person, even though they might have been vaccinated all their life against smallpox and all sorts of other, they've got a vaccination history, yet the family is saying, no, I don't think this is for you. And we really need to respect the rights of older people to actually make those decisions, even when, yes, they might have cognitive decline, but there are ways through a supported decision-making process to actually support people to do that. I'm really pleased that there is starting to be an uptick in the aged care workforce getting vaccinated. We're knowing that around about 86% of people in residential aged care are vaccinated. We know that the rates of over 70, I'll defer to Mary Louise on this, but I think it's over 70% at least some dose. So we're starting to see the trend now for those most vulnerable, but we've got to keep on this journey as well. So I'll pause there. Thanks.
Thank you so much, Craig. That was, again, really insightful to hear from that aged care perspective and from the older person's perspective. Mary Louise, I've got a question for you, starting off with our questions. One of the questions we received from supporters in advance of tonight's presentations was an epidemiologist, an economist, and an aged care advocate go into a bar. How long is it until they can do that for real? Putting it another way, what sort of the numbers need to show for Wentworth to be able to go back to the pub?
For Wentworth or for Sydney or New South Wales?
Well, it's an interesting question, and one that's being discussed very recently is the prospect of having some areas open up and some areas remain in lockdown. What's your view on that?
Well, can I share a screen? I've got 2 slides I'd like to share, and then I'll have a chat. Okay, so I have to press the share button. So normally what we see in a really well-contained lockdown, really well-contained, apropos of the second experience in Victoria, because the second wave was not well handled, and they started putting lockdowns as the numbers started trending down. This is a graph of moving average. Now, I've used 14 days, but I've also done a much smaller moving average for New South Wales because Delta is very fast. But what you normally see now in the American strain during the Northern Beaches and Victoria in the Kappa Delta was that it goes up at about for 15 days if you've got really good lockdown. You know, you can't go more than 5 kilometers, you can't go out at night, you have to wear a mask outside all the time, not the way we're doing it now. And every service basically stops except for those that feed you and make your medication. And it normally goes up about 15 days, then takes another 15 days to get down to 0, and then 14 days of 0 thereafter. The reason we use 14 days is in outbreak management, you use twice an average incubation period to say that you've got mitigation, and then twice the maximum to show that you've got elimination. So it normally goes like this, where you can see this red dot going up and going down, and the red dot was the Northern Beaches. Why it peaked higher, wasn't a variant of concern, was because they did lockdown light, where they allowed essential services in and out. They did not test them with a rapid antigen test, and then it went into the western suburbs. This blue one was the Kappa Delta. They got onto it very fast, but still it held that same pattern. But this one here is Sydney at the moment, and this purple one here is Victoria. Victoria is a much more contained outbreak. They went into it very fast. On day 3, they announced they were going to start going into lockdown on day 4. I personally would have gone into lockdown on day 1 with Delta. So this is what we look like here. And getting back to the question, I was very hopeful that around the 13th of July, we were looking as if we had reached a peak, even with the 3-day average, because this, as I mentioned, the serial interval is very, very short. And then I was thinking, great. And then it peaked a bit again, and we've had false promises twice. And yesterday and today, it was very bleak. I realized we're not going to get out of this fast because we have not had what I would call proper lockdown. And today and yesterday's numbers actually reflect what probably happened during the weekend or maybe Monday. And people are getting it at work and they're getting it socially. We need to know exactly how they're getting it so that if you wanted to lock down the rest of Sydney and open up the eastern suburbs, that's very difficult because it's really too late. It's escaped. It's now escaped to Orange, Bathurst, probably the Southern Highlands. So I don't think that we're all going to be able to lift our restrictions in certain suburbs because we are so interconnected. And that's why, with a variant of concern, you actually have to go into a rapid stay at home as much as possible in the first couple of days. So this down here is Victoria. And look, they had an advantage. I mean, they basically, their advantage was that, oh, I'm sorry, I'm trying to turn this off for you. Their advantage was that they knew that something was going on. They did a lot of rapid contact tracing, and so they were able to get onto it faster. And they'd only had, I think, up to 14 cases in total, where we waited until we had 54. So we're not going to get out of this, and we're not going to be able to lift restrictions, I don't believe, in the eastern suburbs. If I was in control of this, I'd say, I'm sorry, you've waited too long to be able to ring fence certain areas.
Those are disturbing graphs. There seems to be a number of questions that have been lodged on the chat. So I have other questions that I can go back to, but I think I'll throw to Tracy, who is one of our Voices of Wentworth volunteers, and ask her to read out what she thinks is the priority questions first, and let us know who that's directed to.
Hi everyone. Many questions seem to be to Mary Louise at the moment. One was around should we wear masks outside, which I think you just answered, and you kindly answered a couple of them yourself. Thank you. Then there is one about a different strain, which I wasn't aware of. So there is something around. The question is, given talking about concerns Delta now has been circulating globally for a while, should there be a greater focus on the risks of the Lambda strain? Mm-hmm. Do we need to restrict overseas arrivals further?
Ooh, okay, they're all really tough and difficult questions. Okay, yes, you have to wear a mask even if you go for a walk, even if you walk your dog who's 20 years old, you have to wear a mask. The thing about this particular variant is that it's broken all the rules. If you walk past somebody and then see a neighbor and start to have a chat a couple of meters away, even if you're outdoors, it's not safe enough. Please wear a mask. If you haven't had your second dose of AstraZeneca, you're not safe. You're not safe until 14 days after your second dose of AstraZeneca or Pfizer. So assume that you're at risk and wear your mask. Then the next question was Lambda. And therefore, should we open our border, or should we close our borders? So I'm not a human rights lawyer, sorry, excuse me, but given I work with WHO, we are constantly reminded that we have to work in a framework of ethics, constantly. And I'll just read to you, has anybody opened up their passport recently in great hope that one day you'll get to use it again? And have you seen the inside page? If you haven't, let me just read this to you. The Governor-General of the Commonwealth of Australia, being the representative of Australia of Her Majesty Queen Elizabeth II, requests all those whom it may concern to allow the bearer, an Australian citizen, to pass freely without let or hindrance, and to afford him or her every assistance and protection to which he or she may stand in need. So our government must show its care for every single soul that has an Australian passport and is a resident. There are many people who can't take up citizenship because where their family are, they don't allow them to have dual citizenship. The residents are just as important. And given that our quarantine has been the main problem of over 21,000 cases to date, oh, thank you, my kind husband bringing me a glass of water. Given that over 21,000 cases since the 20th of March 2020, he can't give you one, Delia, have actually occurred because of breaches of quarantine, I can understand the knee jerk. And that we've had over a year to then plan. And I'm sure Rick would agree that the cost of lockdown, which is for big cities like ours, $1 billion a day, a purpose-built quarantine facility would be a fraction of that. It would be about 500 to 700 million. So we could have made multiple facilities by now and been able to put those return travelers either from countries with Lambda, with Delta, with Beta or Alpha into there. We cannot possibly think we can contain a variant of concern in a hotel, because a hotel is not a proxy hospital. In hospitals, I don't know if you realize, but there is a regulation about airflow change. That's at least 16 liters per second per patient. Otherwise, it's about 6 airflow changes per hour per person. It's huge. And no one office or no one hotel room reaches that level. So we can't bring them back safely, but we should have by now. What we can do is offer them the vaccine. And to leave Australian Indians in India without any care is absolutely reprehensible. And we left them to die. We had a couple of deaths. So why could not we have sent Pfizer over there so that they didn't take any local production, get vaccinated, and keep them safe until they've been vaccinated, at least with one vaccine, then test them. But if they were positive, put them somewhere safe and care for them. I mean, I've just read there that surely we should be giving them every assistance and protection. That is what Australian leaders should be doing. Not just protect us because we are in Australia, but every bearer of one of those beautiful passports. So there you go. I've had my complaint. It's not good enough to keep Australians offshore. Never.
Thank you, Mary-Louise. I'll throw it to everyone now. There's a question here about Scott Morrison today said no country is managing Delta strain. Is that correct? What nation is doing best with Delta and why? If any of the members can actually answer that on the panel.
Well, there's no country that's actually, I mean, we were doing brilliantly by accident, by design, until we kept our eye off the ball with system errors. In patient safety, which I do when I'm not doing outbreak evaluation, we put in, Americans have this brilliant system of multiplying very ordinary patient protection systems that don't have great evidence, but altogether they bundle them and it's brilliant. You make sure their skin is clean before you put a sharp catheter in. You make sure you put it in the right spot. You have clean hands and so forth. It's a bundling. And so we have not bundled protection against escaped viruses through staff that have anything to do with the quarantine program. That poor driver shouldn't feel guilty. His employer should. There should have been a system when he was exposed on the 11th. There should have been a system that would check the FedEx crew. As soon as they taxi up, they have a rapid antigen test. Now, when you're told by the government that they aren't accurate, that is not true. There are about 12 of them that have been TGA approved, and there's at least 3 or 4 that I can think of that are somewhere between 98 point something to 100% accurate, and the saliva PCR test is 87%. These rapid antigen tests take 10 to 15 minutes, and they cost a fraction of the price. And I can only assume that there's some sort of cabinet and confidence or commercial agreement between the government and the private pathology companies that have excluded the use of this new science. They've been using it in America. They actually use an Australian take-home test. We are not allowed to give take-home tests to Australians, and yet every teenage girl or woman that's concerned about a pregnancy has been using these pregnancy take-home tests. So why can't we use these? Why can't employers be testing their employees when they turn up to work, when they're essential, like truck drivers? So that was one error. And then the other error was this poor man acquired it on the 11th, but wasn't tested until the 17th. Where was the system? That system failed him, and it failed the community. So you put in multiple systems to prevent this from ever happening, and I haven't seen an improvement in the systems. So I'm constantly concerned that we're going to keep seeing this, and yes, we'll keep seeing variants mutate and circulate. And I don't know if Rick and Craig have anything else to add to that.
I mean, not to say the countries that have done it well, obviously those with higher rates, and we're seeing sort of with some of these outbreaks where older people who are vaccinated still do get the disease, the virus, but are surviving, and the conditions are much, the symptoms are much less as well. But I'd agree with you, particularly in aged care, the ability to access rapid testing, now whether it is a rapid antigen or whatever, but that is where, as people are moving in the community, moving back and forth, unless we're quarantining our aged care workforce before they go in, and we have seen some examples of that where some places have the staff, out of an abundance of caution, have moved into the facility so as not to bring in COVID to the facility, and good on them. But I mean, that's a big ask to ask families to do that. So the only other thing is a test that gives you a result very, very quickly, as well as the really, really strict infection prevention control measures that have to be in aged care and that we can't step away from, even when there's a large vaccination level, where we're still sort of, but definitely at the moment where we've still got maybe a quarter of the aged care workforce vaccinated.
I mean, some of these rapid antigen tests can have, one of them has 100% accuracy in those first 5 to 7 days of being asymptomatic. If you're symptomatic, go home. You shouldn't be looking after the elderly. But if you're asymptomatic, they work really brilliantly. And then one of them is 99.96% accurate, and another one is 98%. And at the moment, you've got zero certainty. The more you test the staff, the more accurate they become. But in England, I'd just like to remind you that Delta has taken just 2 months to become the most dominant strain in England, just 2 months. And so therefore it's a bit too soon to say it's not more deadly. There's usually a 28 to 30 day time lag between entering hospital, being admitted, and then having that 28-day mortality rate developed. So, but at the moment, it doesn't look as if it's any more deadly, but you're twice as likely to be admitted to hospital with Delta than with Alpha. So we need to keep that in mind. And that is why,
Yeah.
Sorry?
Unless you're fully vaccinated and had that time
Exactly.
after.
Exactly correct. If you're fully vaccinated, you will be protected from hospitalization and therefore death.
I might just chip in there with a question for Craig. So at one point, the Liberal Senator Richard Colbeck and Health Minister Greg Hunt suggested that people in aged care had opted out of receiving vaccines when many facilities had yet to receive them. Is hesitancy a factor in getting older people vaccinated? And if so, how do you address that?
Yeah, I think so. There was a whole mix of issues there, and it wasn't just hesitancy. There was people wanting more information, and getting that information to older people and residents and their families in a way that was digestible and understandable and answered the questions that they want. And we have to remember that to go to your GP in aged care is really, really difficult, because the GP is only there, they're looking after multiple persons that actually have a proper conversation with the GP. So quite rightly, people had some questions. When we found that people actually took the time and actually explained it, and that was often the aged care staff that were doing that hard work, people did consent. And older people have got a strong history of consenting to vaccinations. Now, the fact that we're at 86% having the first dose and sort of at that high 80s in residential aged care, even in second dose, shows that it's done. I mean, there were some areas like Frank around Wentworth where there were lower rates, and also families who were making decisions not of the wishes and preferences of the person, not in line with their vaccination history, but actually saying, well, I just don't think you should have it. So when the risk profile and actually the benefit to risk was properly discussed and people had time to weigh that up, they did take it. And availability was one of the biggest challenges. We've now had the clinics go round to actually do that, and that's why we've got such high rates. But they're doing what they call mop up of these roving clinics to get those who might have also come in later on.
Thank you for that. So Tracy, we got a lot of comments coming up. Are there some more questions?
Look, I'll move on one to economics, to Rick. Given that what we've just been talking about, and probably unlikely this lockdown to be going on further and further, we've had this huge, strong economic growth. Despite the lockdown, it is sustainable. The halt with construction, 80% employment being in services, likelihood that we will see migrants coming for at least another mid next year. What do you think is going to happen? Do you think there's going to be another downturn?
So almost certainly we're in a downturn now because we've shut down a whole bunch of the economy again. So there's no doubt that output will contract this quarter. But in terms of should the government support the economy, well, I actually think they have an obligation to support the economy, because ultimately the government has made a policy decision to say that people can't go to work. So I think that the quid pro quo there is that they have to support. They did it last time. I think it worked remarkably well. And I should say it's very easy to be critical of policymakers, but I do it for a living. But they moved very quickly last year and they put in place JobKeeper, which I think was about the best program in the world. They were very lucky they had Stephen Kennedy as Treasury Secretary. They had the right people at the right place at the right time. And I think they've got to support it again. In terms of, is it sustainable? Now, I'm a fiscal conservative. I think that over time you should get the budget back towards balance, but this is not a normal time. This is a crisis. And Australia has oodles of fiscal capacity. So Australia went into COVID with net debt of about 20% of GDP. It looks like we've come out the other side at something like 40. But to put it in context, the United States went in at 90 and is coming out at 120. So our balance sheet is pristine compared to any comparable country in the world. Now, that doesn't mean that we should blow it. And when the time comes, we need to rein it back in. But this is not that time. And you can see that the bond market is not in any way concerned about debt levels. Interest rates around the world are incredibly low. The dirty secret in all of this is that interest payments for the federal government are going to be lower next year than they were in 2019 because interest rates have come down so much. So at the moment, they need to spend, and in particular, they need to make sure that those vulnerable people are okay. When they talked last year about building a bridge to the other side, we need to build a bridge again. And hopefully that other side comes pretty quickly.
I think one of the interesting things, though, the impact of that, just economy, but also workforce. I mean, we've got up the back of the Royal Commission into Aged Care Quality and Safety, there's meant to be a whole expansion of workforce, but where does that workforce come from? Often it's from overseas. So there's going to be a workforce challenge as well as an economic challenge.
So we're seeing now. Any more questions from Delia?
Yeah, one thing I wanted to address is to Mary Louise. Because we are a diverse electorate, there are a variety of views, and certainly I'm a member of a number of local Facebook groups, and there have been comments made on those that suggest vaccine hesitancy, to say the least. And I just wanted to kind of list off some of the comments that I've seen on those chats so that you can address them, because I think it's important that they are answered. So one of the concerns is that vaccines haven't been around long enough for scientists to know that they're safe. Another one is people saying that they think COVID isn't real or that it's no more harmful than the flu, and that countries with widespread COVID really aren't experiencing excess deaths over what you would expect. And some people saying that their natural immunity with a healthy lifestyle is enough to deal with the disease, so they don't need vaccination, or that there are products to cure COVID, so we should be using those instead of vaccinating. What do you say to those people, assuming that some of those people are not hard and fast in their view and are open to discussion and information?
Well, I just remind them of that, the castle. Tell them they're joking. I mean, first of all, tell the families and friends of 915 people dead in Australia that should not have died, and over 600 of those were in residential aged care. And I'm sure Craig will tell you how incredibly upset the staff were, the families were, their friends that were left without them. Tell the UK that have lost 129,000 lives that wasn't anything over and above what you'd expect with flu. Well, this is not the flu. This is COVID. That's 129,000 people dead. Tell the 626,000 Americans who had died, all their friends. So, you know, if you add 2 people, you're talking about over 1 million people, 3 million people upset by all of those deaths. Tell the parents that they've lost their young adults. Tell the parents that their young adults have got long COVID and may be too tired with unpredictable long COVID and, you know, shocking tiredness, you know, fatigue, that they can't work, that they may never plan to have the grandchildren for them. And they never, and, you know, Rick will probably attest to this, that they'll never be productive. And they'll have to be supported for the rest of their lives, because we've even got people now with long COVID that have been sacked from jobs. I've had nurses and doctors tell me that they've been sacked from their jobs, and they understand it because they can't get to work. So tell them they're joking and get real. So we've had, just to remind them how they're joking, so you've got me on a bad day because our numbers have upticked right now. Normally, my blood pressure is very low. Tell them about the one person that was 20 to 29 that died, 2 that were 30. I've got the notes here. 2 that were 30 to 39 years, 2 that were 40 to 49 years. That's 5 people we've lost that we should never have lost. The 16 people that were 50 to 59. Now the 50s are the new 30s. Tell the 38 people that are 60 to 69 that are not here anymore, and the 856 people that are 70 years and over, and 70 is the new 50. So tell them they're joking and get with the program. I'd also like to then calm down a little and then explain to them that there have been tens of thousands of really generous human beings around the world that have put their arm out as participants in Brazil, in Russia, in China, in Australia, in England, everywhere. And we have been able to produce vaccines at the fastest pace in history because it was a pandemic. Now, when I worked on the 2003 outbreak, no vaccine producer wanted to make one because it was just an Asian problem, sadly. So this is a pandemic, and therefore the pharmaceutical companies realized that they could make a lot of money out of this. And they've had tens of thousands of people come forward and help. Normally it takes about 15 to 20 years sometimes to get enough people, particularly in certain age groups and certain genders, to be able to trial a vaccine to ensure it works for those gender and the age group. But this has been remarkable. So this is not just something that's been made overnight and hasn't gone through enormous testing. There's a European Medicine Agency that collect all of the adverse events. Now, sadly, as AstraZeneca's adverse event is very, very, very rare, but it's too common for our young to even think about AstraZeneca. If we had a choice, we don't really have a choice. We have a Sophie's choice, but I wouldn't advise anybody 18 to 40 odd to even think about AstraZeneca, given that your risk of thrombosis and thrombocytopenia syndrome is 3 times that of a 60-year-old Nova. So the other issue is people think they can't get pregnant when they have a vaccine. I've never heard of that one. That's adorable. Never heard of that one because we could use it as new contraception, but I've never heard of it. So tell them they're dreaming. Tell them they're joking.
Thank you. Thank you for addressing it. I think it's something that just needs to be raised in order to be addressed. I'm just mindful of the time, and I know that you're all very busy people. So I thought I'd just kind of wrap up with a question, which is, if you were Prime Minister for a day and you could do 2 things, briefly, what would they be to try to fix this going forward? I'll throw to Rick.
So I would be calling the CEO of the big drug companies and getting as much Pfizer and Moderna in Australia as possible, as quickly as possible. And given that that will still take some time, I would make sure that we have a Rolls-Royce distribution system ready to go. So when those doses hit the country, they are in somebody's arm the next day. It's by far and away the thing you've got to do.
Excellent, thank you. Craig, your 2 things.
Yeah, so distribution, I think I would be making sure that every chemist that we know, our chemists know how to do drugs in that right sense. But they should be out there. That's the local community. It should be able to be done. For the distribution networks are in most locations. I would also be promoting the benefits and the community citizenship that we need to all show about not being individuals here, but contributing to our society and being a good citizen and getting this. So picking up campaigns that actually work, looking at what they've done in Victoria and the Victorian artists who have gone out and just done it and said, this is what it looks like to do it well, and this is what it's going to bring us back to open again. Get out and do it.
Excellent, thank you. Mary Louise, your 2 things as Prime Minister.
Oh, well, look, I think Rick and Craig have identified 2 really important areas. I would allow rapid antigen tests to be bought at pharmacies like they do in the UK so that people can take them home. I would encourage businesses to use them when there's circulating virus to ensure that they can keep their employees safe and the customers safe. And I'd change the ad. I think the ad is so un-Australian. Have a look at the New Zealand ad. Have a look at the joy and fun of the Singaporean ad. Have a look at the US and the Canadian ad. There's hope, love, sociability, and it's all the things that Australians used to be. Mateship, and it doesn't matter where you come from. 42% of us were born overseas, or a parent was. And as soon as we get here, we all care about our community. So there's a collectiveness, but it's these ads are not addressing that, you know, let's look after each other with the hope.
Yep.
Fantastic. Thank you so much. That has been absolutely insightful. It's really, in some ways, it's really raised some concerns for me, but in the other ways, it's also allayed some, as long as we can get this current outbreak under control. There's so many questions. This is obviously a very complex topic. It's the main thing that we're facing right now. So we haven't been able to get to everything, but I hope that it's addressed the key questions that our listeners have, our followers have. I'll just say again, don't forget to respond to the questionnaire that's been put into the chat and to keep an eye out for information on our next events that are coming up. The best way that you can do that is by subscribing to our mailing list. So I'm hoping that one of my colleagues is putting the link to the mailing list in the chat so that you can click on that and join up. And we don't bombard you with information. We send out a periodic newsletter when things are happening to let you know, so that you're the first ones to know. Thank you again to our superb speakers. That has been fantastic. This video will be available on our YouTube channel and on our website. So I think that's going to help a lot of people who will watch that going forward. Thank you so much. And thanks for everyone for joining, and good night.
Night. Stay safe.